everyone for being here. My name is Brittany Dwyer. I'm with the Mental Health Association. We serve Fauquier and Rappahannock counties, and our mission is to promote and facilitate mental wellness in our communities. And we're so fortunate to have Rappahannock Rapidan Community Services as one of our partners that we like to do things with. We do a lot of educational programming with them. And so we're kicking off our summer series here, which focuses on youth and supporting our young people. And so we're fortunate to have Alan Rasmussen from our RCS as our presenter. So I'll let you take it away now, Alan.
Okay, Brittany, I appreciate that. And I don't, I want to make sure, I think it's worth saying a little bit about me. I don't like talking about myself, but, maybe why Alan Rasmussen, why is he here? But I am a prevention specialist with Rappahannock Rapidan Community Services. I've been working in that position since 2003 with a focus on suicide and substance abuse prevention. I also do some part-time work for National Counseling Group as a community counselor, sometimes involved in crisis stabilization, home-based services, and intensive supervision at the home. But I am Board of Counseling licensed as a qualified mental health professional, able to work with children and adults. I am also mental health first aid, adverse childhood experiences, and QPR, suicide prevention gatekeeper, certified trainer. And some people, I don't like to talk, like I said, but I am retired from the Virginia Department of Corrections. I worked there for 28 years and retired as the chief probation parole officer. And I like the prevention work I do now because I have heard some people say, hey, the work you were in with corrections, you saw a lot of what happens to people if you don't do prevention work. And so some people even think that makes me a better prevention person, because I can know what happened if you don't do some of this prevention work. So with that said, I want to say this. I'm excited to be here with all of you today, and I'm very happy and excited to be involved with the Fauquier Mental Health Association, to be in partnership doing what we're calling this community mental health training series. And so there's been a number of trainings that we've teamed up to do, and it's a partnership. So I'm doing the presentation today, but I can tell you right now, Brittany and Stephanie, they're engaged in researching, and we work together, and they put together PowerPoints. So they're involved big time. And, and you'll hear from Brittany, and if Renee is here, and she is now, you'll hear from her as well. So this is a team effort. And so I'm just pushed out here to kick it off and be the speaker. And we're all doing it together. And I do know that it's been a good turnout, and people are excited about it. So we're here to help and make a difference. So I'm going to pull up this PowerPoint. If you hang with me here a minute, I'll share that, and we'll begin this presentation. Move a few things out of the way. And so today we are talking about supporting the anxious child. Now, we've got enough time. I'm going to have some engagement. I'm not just going to come in here and do this presentation to you. I want to do it some with you. So just on the surface of this, we're going to warm up a little bit. Why would we want to do this presentation? Let's put that on the table, hear from you all. Why is this important to talk about? I mean, I can tell you why it is, but I want to hear from you too. Why do you think it is?
Alan, we have something in the chat that says because suicide rates have gone up during the pandemic. So knowing about anxiety is important for that reason.
I like hearing that, because not that it went up, but yes, it has. And when you look at mental health issues, they can be the road for people to begin to think about suicide. It is tied in with depression. And so they go hand in hand from time to time. So it is important to talk about it, because we may be saving a life when we help somebody. What else?
We're also seeing from Alicia, she said, we're seeing more kids with trauma and the effects of trauma on children.
Yes, and that's why I like doing that adverse childhood experiences training, and there has been an increase in children experiencing trauma, no doubt, and for a variety of reasons. I'm not going to go into all that now, but COVID, substance abuse, you name it, it's impacting kids. Anything else there?
To stop generational cycles, help children learn coping skills and thrive. Megan said it's easier to support kids when they're young versus, trying to fix the hurt that we cause by not knowing how to support them in adulthood. Um, and some people said that, they don't believe that their children will just, quote, grow out of it, of what's, happening with anxiety. So that's
Yes.
what we see in the chat.
Oh, well, that's what I'm loving, and that's exactly right. And that's what I like about prevention work. You get involved early, and we'll talk about ages when the age when this starts to be recognizable and it's going on. So the earlier you catch it before it goes on, or right when it starts, when you get involved and head it off, is way better than waiting to someone's an adult and there's been some harmful effects. So yes, this is definitely a great prevention issue, and it can respond well to a prevention effort. So let me, in my effort to continue through here, sorry about this. What does anxiety look like? I want to say this. I'm in this field right now with prevention where we talk about risk factors, warning signs, symptoms, and risk and protective factors. But when we think about anxiety, and we're talking about signs, what does it look like? What does it look like? It can be recognizable, but I want to hear some comments from you all. And you can put them in the chat box, or you can just pop on here and talk. I love hearing people's voices. We've been isolated some. I've been trying to be out there around people, and I love the Zoom. So don't feel free to talk. I like to hear your voice. So give me some examples of what anxiety looks like. And if anybody has experienced anxiety, what's it feel like? What's it look like? What's it feel like?
I think we're waiting on some things to come through
Okay.
in the chat box.
Yeah, I'm not going to rush to your aid. I'm asking, as I know if you were to, we usually do that mental health first aid training, and we say, hey, take the alphabet A through Z and give me a word for each letter that is a sign or a symptom of anxiety. And so, what are some signs or symptoms of anxiety that you see a behavior or whatever it is, and you say, oh, they might have anxiety, or that's anxiety. What do you see on that chat box there?
I see feels like fear, and the fear response, asking a lot of what if questions. So, and we'll talk about that, anxiety
Yes,
being kind of future oriented. Bedwetting in kids can be a sign of anxiety, avoidance,
beautiful.
sadness, anger, withdrawal, all of those.
Yes, yes, and much more, no doubt about it. So I appreciate you all jumping out. I'm warming you up because we're gonna do some more talking. So, I love this picture here, and I think people can look at this and get a clear idea on what it can look like. And I thought it was a great diagram. A possible sleep disturbance, feeling breathless, breathing fast and shallow, sick on the stomach, lack of appetite, the heart may be racing, trembling, sweating, shivering, wanting to run, jelly-like legs, restless, and the dizzy, disoriented, lightheaded. Now I like to say this stuff, and I think this is a great point. Signs are things we see, and symptoms are what somebody experiences. So the point I always like to make is when you see a sign, what you want you want to train your mind, say, hey, that's piquing my interest, that sign, but I'm not going to know what's going on with this person, what the symptoms are, what they're feeling, what they're experiencing, unless I go to them and explore what I see with that sign. Okay. So, and if you hear me, if I see a sign, I'm going to go talk to somebody. Hey, I see this. What are you feeling? What are you experiencing? I'm going to open up a door where this person will talk to me and tell me more, so I can get a feel for any symptoms that may be there. Because keep in mind, you might see a sign and it might not mean anything. That's what makes prevention work difficult, and makes it easy to say, hey, people can show that sign, but nothing's going on. They're fine. So it's easy to ignore what's going on, pass it off, and not get engaged and check it out. I always like that philosophy, and I'm just throwing this out here, but when I see a sign, uh, I go, okay, what's possible with that sign? And, my initial reaction to that is anything's possible. I'm not going to know if I don't check it out. So think about even doing that gatekeeper training for suicide prevention. And here again, it's a great analogy. When you see signs, a lot of the signs for one issue can be signs for another issue. So we won't know. It might be that someone's depressed. It might be that there's some anxiety. It may just be, hey, they're a little bothered that day, but they're coping. And it might also mean that somebody's having thoughts of suicide. So we don't know. And I've geared myself up to always look at signs and, just engage, talk to people, connect with them, and then maybe see what's going on. And you either make a friend or you help somebody. That's the way I see it. So hold
And
on.
Alan, could I interject one thing too about signs
Certainly,
and symptoms?
certainly.
One of the things that we teach people in mental health first aid is to look for, multiple signs and symptoms. And so a lot of times when we're seeing anxiety presenting in children, it's not just going to be one of these things that we're going to see. Usually you're going to see 3 or 4 of these signs or symptoms, or maybe some others that aren't listed here on this little picture that's called shaky man. So when we're starting to look for, is this anxiety, is just maybe a bad week or a bad day, looking at those cluster of symptoms, are there 3 or 4 that exist for that child? And if so, it's probably leading to a problem, if not is already an issue or challenge for that child.
I like that, and I appreciate it, Brittany. And again, to follow up on that too, and we don't want to overdo it, but I like to check out each sign, because you may not see all the signs. And sometimes people think, oh, that's just one thing, but there may be other issues going on. So it's worth checking out. And I'm going to move forward here. What is an anxiety disorder? Now, I'm going to tell you, I like the slide here, and I want to tie this in. People can be anxious. They can, and that could be a healthy response and a way to react or be. And the key point is, when is something a disorder? So some of these other trainings that we have, we talk about what's a mental health disorder, what's a substance use disorder, what's an anxiety disorder. And so in this slide helps people who are gatekeepers, so to speak, or taking an interest in people. When is something normal and okay and functional, or when does it become a disorder where someone may need some professional help? And so I want you to think about that too, because, I see that a lot in substance use. People use, drinking is legal if it's an adult, and you think, well, hey, they're just drinking. And so when does drinking become a real problem? And you'll hear this verbiage a lot when you're looking at disorders, it doesn't matter which type, it's when it affects your thinking, your moods, your relationships, your work, your daily responsibilities. So let's apply that concept to what is an anxiety disorder. And again, keep in mind, we all experience stress and anxiety. It can be healthy. It can be fine. Examples: anxiety helps us to survive some situations. It can boost our motivation to achieve. People can get anxious about a couple things, but it can spur them on to act and say, okay, I got to gear up. I have to go. And anxiety disorder differs from normal stress and anxiety when the symptoms of an anxiety disorder are more severe and can cause impairment. Again, here we'll hear this language in daily life, meaning if it's a student at school, if it's an adult with their work, in their daily activities, the things they typically do, if it's homework or other daily habits they have and routines that work for them, and it interferes with that, or in having a satisfying relationship. If it's a young person with other peers or adults, same thing. It could affect a marital relationship and satisfaction with life. How much are they enjoying life? Is this interfering with them having a satisfying life? So, and I think we're all in a position we could probably spot when some of that's going on, and when it is, we need to start thinking along the lines. And again, I'm going to say this: we're not here to teach people to diagnose. We're not here to make people counselors, and some of you already are, but we're not here to diagnose. And again, this is geared for parents and other people, but it is geared toward uh, giving you a clue when maybe someone may need to be linked to an appropriate resource for professional help. So just food for thought, and I think it's good food.
And Alan,
So
one
yeah,
of the things that we hear a lot from parents, they're like, well, how do we know about, what is the difference between stress versus what's the difference between an anxiety disorder? How, as a parent, can I tell that? Or how, as, someone who cares for a young person, think about that? And so, when we're talking about stress and anxiety, there are a couple key differences. Stress is usually caused by some sort of issue within the environment of the child, and it can usually be short-lived. So, a child could, let's say, have a big test coming up for math and it stresses them out, right? They're nervous, their stomach hurts, they don't want to go to school because they don't want to take this really important test. But then after they take the test, they start feeling better, they're able to engage normally, and, the issue or challenge has subsided. Versus if a child has an anxiety disorder, not only would they be worrying about that test before the test happens, but likely they would be worried, for weeks afterward, probably not just about that test and how they did. And, maybe I failed this test. They would be really, really worried about everything else. Oh my goodness, if I don't pass this test, I'm not going to get into college. And if I don't get into college, I'm not going to be able to get a good job. And, it can just build and build and go on and on. So a
right.
lot of times an anxiety disorder is going to be internal. It's going to be something that a person maybe can't control as well. So, with anxiety being present in a child, you're going to see these signs and symptoms persisting even when something in the environment has changed. It's going to continue for that child.
Yes, and it's persistent worrying, and it can interfere really if they're wanting to do well in a test. It may even interfere with them being able to study well for it and calm down and remember what they're trying to learn. And that crippling, it can cripple. So appreciate that, Brittany, big time. So, when you look at, and we mentioned this a little bit in the beginning, we were going to talk about when onset of some of these issues can go on. So the median age of onset, and keep in mind that first block up there on the right top is half of all lifetime cases of mental illness begin by age 14, 3/4 by age 24, And so if you just look at that, it's important with any mental illness to be alert to signs and be trained to spot this so we can get involved early. And the sooner someone gets appropriate help, the greater the chance this is not going to have a lifelong complication for them. They'll be able to cope better and deal with any issue they have. And so when you look at anxiety disorders, median age of onset, age 11. And if you look at the other eating disorders, age 15, substance use disorder, age 22, schizophrenia, age 23, bipolar disorder, age 25, depression, age 32. We can spot this anxiety disorder early. And when it is a disorder, identify it, call it what it is, put it on the table, and then explore it and do something about it. And the increasing incidence of anxiety, this is some good information here, I think is good. Anxiety and depression have been on the rise since 2012. I can tell you, in the work that I do and the work many of you all do, this anxiety has probably been one of the fastest increasing disorders that I've seen. And everywhere I go, people talk about how significant the increase in anxiety they're seeing in youth and adults. So it's definitely a community issue there. It cuts across all demographics, and it often affects bright, creative children. And so treatment, and we hear this and see this a lot, but treatment is 60% to 90% effective. But the piece we hear too often is only about 20% get treatment. If you look at mental health disorders in general, only about 40% of adults get the help they need. Sometimes they don't get recognized, they don't get referred. Unfortunately, a lot of times there's not available treatment. We're all aware of that issue. So 30% of girls and 20% of boys have had an anxiety disorder. That's according to the National Institute of Mental Health. So some red flags, and here we're talking, when I talk red flags, I'm talking about these warning signs, something that should pique your interest. And always remember, the sign is what you see. We don't know what's going on until we check it out. So red flags in a school setting can be inattention and restlessness. For some, the first thing people sometimes say with that is ADHD, but we're not here to diagnose. It should pique your interest. And if that's something that, I like this, if something repeats itself, first time, it's going to pique my interest. But if it's going on repeatedly, that's really going to pique my interest, and it's time to check it out. Attendance problems, disruptive behavior in the classroom, trouble answering questions in class, and then physical complaints, frequent trips to the nurse. And I got to tell you, I'm going to go back this thing. If you just see those right there, it could be one of many issues. And again, I'm just gonna have to keep pushing this concept that when you see the signs, we don't know what it is. We need to, if we see enough of it, we need to get someone to check it out. Counselor in a school, somebody who can make an assessment and check it out. So again, these are all signs of someone who could be depressed. It could be anxiety. It could be other issues, or it might not be an issue. So, and then problems in certain subjects. This could go hand in hand with learning disorders. And if you have students that, if children, they're not turning in their homework, they're avoiding socializing or being involved in work groups. I mean, those are the, you start to think, hey, what's the issue here? Are they just shy, or if they just can't get involved and handle any situations at all where they're interacting with other people, it's worth coaching, checking out what's going on, developing strategies, or seeing if there's something else going on. Distress out of proportion to situations, that fits that definition of anxiety, where someone gets in distress over something going on. It's really, we might say, oh, hey, this could be tough to get this homework done. Oh, I'll never get this done. I don't see how I can get this happen. Oh, I just can't handle this. That kind of talk. So it's, wait a minute, let's talk. Let's go work through this. If we think about it, we can come up with a way you can get that done. Or worry a lot. And this perfectionism or being overly responsible, it can be a red flag. And I don't mind inserting some things. In all the years I've worked and the work I'm in, I remember clearly one point in time where this perfectionism in another school area, I got called to another area to do some work because perfectionism was off the chart with the students. And there had been a suicide in that school. And in talking with the teachers, they said, hey, we've got a significant number of students that say, I have to have an A+. If I don't have an A+, I can't handle that. So I mean, it was, it's got to be just like this, so perfectionism can be an indicator. Problems caused by anxiety, the harmful effects of anxiety, some outcomes from having anxiety disorder. Academic failure, it can interfere with that schoolwork. Remember that definition of the disorder? It can interfere with school to the point where there's academic failure, not turning in work, can't go to school. And if it doesn't get identified and helped, it can lead to this academic failure. Isolation, resisting new activities or trying new things. I mean, that's a great example of someone who may be having an anxiety disorder, or it can be self-esteem, self-confidence, all this stuff ties together, but they resist it. I'm not going to do it. And you think, whoa, man, we just can't get them to try something new. School refusal, meaning I'm not going to school. I can't go to school. Don't make me go. Please don't make me go. I don't want to be there. And then, sleep disruptions, and also some of these mental health issues, but anxiety, the same, can lead to substance use. Over my years, many times I've asked adults and kids, like smoking, why do you smoke? Hey, it calms me down. I've got anxiety. Well, hey, is there another way we could get you help other than maybe smoking? See somebody, because we know the outcome of smoking. Or substance use, drink, self-medicate, use other drugs. I'm sure I'm not telling you anything you don't know there, but it's important to address anxiety so you can head off some of these major issues. Types of anxiety that can be misidentified. And so think about that title there, types of anxiety that can be misidentified. And again, it goes back to this recognizing. So let's say somebody's quiet, and we go, well, they're just quiet. And, if I'm a teacher, I may not mind a student that's quiet some, as long as they're getting their work done and turning it in. And, but if they're never making a comment, but keep in mind, some anxious youth appear quiet and well-behaved. So again, if you see that, hey, there's nothing wrong with them, they're just quiet, but Let me just say this too. I teach courses for the University of Virginia, the Bachelor of Interdisciplinary Studies program, and I see some of the things we're talking about here in courses I teach. And I like class participation as part of the grade. So me, if I see someone having trouble interacting, coming forward, making comments, and I never call on people, I like them to step forward and do it. I'm going to approach them later and say, look, I want to help you here. You're not seeming to talk. Is there something going on? Is there a way I can help you? Or what are you feeling? What are you experiencing? So it's a great way to maybe approach somebody and use some of that mental health first aid training, or just let people know you care, youth, adults, anybody, and explore what's going on. So, and then you get, once you have a picture of that, you can put the pieces of the puzzle together and figure out, hey, they just need some help. They're shy, or maybe there's more to it. And I don't want to belabor these. I'm sorry if I'm talking too much, but each one of them has enough to say. There's no doubt. So disruptive, so, and I've seen this stuff, and I've talked to principals and other instructors sometimes, where someone's disruptive, out of the class, we can't take it. And I remember this principal one time, he approached the student and said, hey, what's going on with you? And at the time, this guy was sleeping in class, wasn't responding. And he told the principal, hey, I can't sleep at night. I go home and there's drug use in my household. I have to sleep on a sofa. I don't even have a quiet place I can go to sleep, and I'm tired. It's not that I don't want to do this stuff, and it agitates me. I get my personality gets offset by this stuff. So here's again a situation where it's worth exploring. And I did this in parole work a lot. Hey, you're angry. What do you mean I'm angry? That's what I mean there. What's going on? What are you feeling? What are you experiencing? A lot of times they don't even know they're doing it. It's so, and again, this stuff is typically seen as ADHD, or they're defiant. So it's, and again, I always think it's worth exploring the stuff, or have somebody check it out. What's going on? So both scenarios there, the quiet, the disruptive, they can result in youth failing to receive the help they need. You can see it on the quiet side. You never even check it out. They're quiet. They just move on to the next grade or whatever's going on. Disruptive, sometimes we just punch them out of the class, or we try to ignore them and avoid them. So untreated anxiety can result in missed opportunities in career and relationships, and decreased quality of life, as well as other mental health issues. It starts to feed on itself and can evolve into other mental health issues. So understanding how anxiety operates. I hope everybody's doing good, man. If you want to give me a thumbs up or something, I appreciate it. I'm hope you're enjoying this. I'm enjoying being with you, and this is a great opportunity to talk about a major issue. So understanding how anxiety operates. All right, there's some thumbs up. Thanks, Jennifer. See, that's what I love, man. I love seeing people, whether it's on Zoom or not. I know, Renee, we were talking one time about Zoom fatigue, this, that, the other thing. I always tell a short story, and I don't want to eat up all our time, but when I was working at UVA, they wanted me to go to Zoom at one point. And I always told them, hey, I like being face-to-face with people, man. They love seeing me. And the guy, we want you to do the Zoom. So I did it and learned it, got trained in it. And I'm going to tell you what, I love it. I get energized by this stuff. So I'm loving being with you guys today, and I love you being here. So understanding how anxiety operates. Anxiety can be caused by a combination of life events, genetics. There's a hereditary factor, personality type, typically sensitive. If they're sensitive, that can be tied into this anxiety. Childhood trauma, learned behaviors, if they live in it, they're around it, or they're in a home where it kind of pushes you to be anxious about things, fight or flight, that kind of thing. And then environmental stress. And I can't think of I should have said this in the beginning, but I can't think of a better time to be doing this kind of training. When you look at this environmental stress, with the COVID going on, that's one thing. Now we're coming out of COVID, and students maybe they've been at home doing online schoolwork, and now they're going to be coming back to school. I mean, I know the deal, and you do too. Some are going, hey, I'm excited to get back. It was tough on me not being there. Some have gotten used to being home, as well as adults going back to work, and now they're going back. So there's an adjustment piece here. And the schools I'm working with, they're going to do some assessments quick. They're going to check out what's going on with the students coming back, and try to jump on some of these issues that we don't know what we're going to see, but we can guess, jump on it early and help the students adjust. So normal anxiety versus problematic anxiety. Let's look at the left side there, adaptive anxiety. That can keep us safe. Hey, think about that. If you think before you do something, that makes me a little anxious. I'm not sure I want to do that. So you get your mind thinking about it. What could happen if I do this? And then you say, okay, I don't want to do that. So a response to real danger. I'm looking at this, it's making me nervous, and it's real. It's not something in my mind that I'm making up, or it's out of control there. It prevents the repeating of mistakes. Hey, I made a mistake that last time. I'm worried that I may do that again, or I want to make sure I don't do that again. So I want to be alert and check myself out. Disordered anxiety. I like the way you wrote that. I'll give Brittany credit for that disordered anxiety term, but results in functional impairment. You go back to the definition of a disorder. It interferes with, schoolwork, life, things you're trying to accomplish. So it results in functional impairments. It's equivalent to a false alarm. Think about that. Think about a false alarm. You're thinking something's going to happen. It's always going to be, I see this, and they're not right about that. That's anxiety. I'm worried about something, but how many times, you've heard that statement, how many times we worry about something and it never happened. But think about somebody with anxiety, and they think it's definitely going to happen, but it doesn't. So, and it can lead to unnecessary avoidance, where somebody may have an opportunity to get involved in something that can be good, that anxiety prohibits that and prevents it from happening. So 3 pillars of anxiety. And, to me, I'm thinking this is along the lines of, what do you see as core elements maybe of anxiety in people? What are some core elements that you can see? And uncertainty is certainly one. Uncertainty, there's this lack of control. Anxious people, they want to control situations. So anxiety can come about from this lack of control, that uncertainty, and then the perception of danger. So, and I like that this PowerPoint has, there's a number of types of anxiety. And again, I mentioned early, we're not here to teach people to diagnose. And I'm going to encourage you here. I mean, we can go through some of these and talk about them, but I encourage you, and I think we're going to get this PowerPoint to you if you're here today. Take each of these and do a little research. You know, me, I always keep my mental health first aid manual around, my DSM, and you can Google the stuff up, read about them. But that separation anxiety, disorder, for example, and I mean, I've seen this. I've seen kids where there's a split up in the family, a divorce, and then, you know, they're with one parent, they don't see the other that much. And what can even get interesting is if, let's say, they're with mom, and mom's thinking, hey, I'm going to date somebody else, or and the kids thinks they're going to get interested in this person, then they're going to take off, and I'm going to have nobody. I'm going to, you know, I'll be an orphan or something. So this anxiety can definitely creep in with that. Social phobia, you know, fear of social situations can be, and the outcomes can be, I don't want to go to school. I can't go to school. I don't want to go this day. I've got that test, or they don't mention the test. They just say, I can't go to school. I'm sick. But when you go through it, there's a test. They're afraid of the test. They're afraid they're going to fail it, whatever. And then the generalized anxiety disorder can just be that general fear, these feelings of fear and anxiety over a number of different issues. Okay, it's generalized. It's not specific, like a specific phobia could be a dog, or a specific situation or an event, whatever. And so I'm going to encourage you, you know, with post-traumatic stress disorder, obsessive compulsive disorder, you know, Google it up, look them over. If you need more information on it, I don't mind talking to you afterwards, or connecting with you after the training, and I'll help you go over this and learn more about it. Okay. So co-occurring conditions with anxiety. What conditions can co-occur with anxiety? Learning issues, ADD and ADHD. You know, often you'll see a diagnosis maybe of ADHD and anxiety. You know, so they can co-occur. Depression and anxiety go hand in hand big time. And you might want to try to make that argument, well, hey, they're anxious, they're energetic against something, but it could tie in big time with depression. You see those co-occurring disorders big time. So substance abuse as well. And so substance use or abuse. And we mentioned that sometimes when people experience a mental health disorder, they want to self-medicate, so they may use alcohol, smoke, or use other drugs. And so there may be some substance use, and then that can lead to abuse. 45% of people who seek treatment for a substance use disorder also have a mental health issue. You know, so me, I remember the days in probation and parole. I can tell you right now, when I looked at the number of people on, they got to the point where they had a criminal conviction and went to court, put on probation, or did prison time. I'm telling you right now, but 90% had a mental health disorder and or a substance use disorder, big time. So let's understand these signs. Let's go back and talk about some signs again. And again, signs are important because these signs can be indicators that something's going on, like I said, but we need to check these signs out. So increased irritability, excessive crying, tantrums, you know, that could be a sign of anxiety. It could be a sign of something else. But again, we don't know if we don't get involved and explore what we see. Difficulty self-soothing, you know, calming yourself down, it's okay, or self-regulating. Regressive behaviors might be seen, you know, excessive clinginess, bedwetting, physical symptoms such as head and stomach aches, and that's in the absence of any illness, frequent bathroom urges, rapid breathing, chest pains, nausea, and vomiting. I think we saw all those on that chart, the picture of the guy with all those, with the anxiety disorder. So difficulty sleeping or change in sleep patterns. I mean, you know, waking up and go to sleep, wake up, something on their mind, fearful about something, wondering how they're going to handle this to the point where it's waking them up and they're perpetually bothered by it. Psychological symptoms such as frequent reassurance, avoiding situations or people, needing things done the same way. Hey, it's got to be just like this. I can't have it done like this. It's got to be just like this, or in the same order, which goes in line with that to a big degree, that OCD. And so hypervigilance, the child is on high alert, always checking out environments, checking out people, situations, or constantly monitoring what is going on around them, thinking, okay, what's going to happen here? What's going on? So some tips to help a child manage his or her anxiety. And I like these here, but managing anxiety, the goal isn't to eliminate anxiety. Don't set that as like zero tolerance, never have anxiety, because it can be okay. It can be a good thing. But the key is to help a child or an individual manage the anxiety. And so do not avoid things just because they make a child anxious. You know, because and that can happen. Hey, we just stopped doing this. We won't do that. We'll avoid all those situations or those things because it seems to make so and so anxious. You ultimately want to talk about that. What's going on here? How can we make this happen and move it? I like the resilience piece. You know, moving forward. What are you feeling? What are you experiencing? Let's start coming up with strategies on how we can handle this this situation, this person, and or this test. Express positive but realistic expectations, and that positivity is a key in there. Being realistic is big as well. So respect the child's feelings or the individual's feelings, but do not empower these feelings. Hey, I respect what you're feeling. I understand what you're feeling. And I've made sure I completely hear your side on what you're feeling. But let's talk about that. Let's see how that works, how that's affecting you and what's going on around you. And we'll determine, hopefully together, if something needs to be done differently. And if so, we'll do it together. I will help you. So do not ask leading questions. So this managing anxiety continued. And I like this information here. Take it for what it is and think about this. But, and this is big, teach a child to be a thought detective. I like that language there, because what with this anxiety, you want to take these thoughts, and we're talking critical issues here. What are you thinking? What are you feeling? Let's examine that and explore it. Let's catch those thoughts, identify them, collect evidence around those thoughts that supports that thought, or, you know, is there, if it doesn't, we're going to think about that. And ultimately, put yourself in a position to challenge that thought. Hey, I'm identifying the thought. I've got it caught like a good detective. Now, when I examine this, you know, pros, cons, or whatever's going on here, you know, when I calm down and think about it, this isn't going on. Something's working me up. So I'm going to challenge that thought. So, you know, and allow your child to worry. It's okay to let them worry openly, but for a limited amount of time. You know, so help them take control of that. Okay, I've worried some. Now, where's that got me? Nowhere. And this is resilience to me. You know, what's an emotional reaction pattern? Is the worry to whatever a trigger is or an event, situation. And I love that emotional reaction chart I always show in the resiliency presentation. So there's something that we react to. And if we do this worry or get anxious or get angry instead of cope with what's going on, that keeps us from moving forward. And the way to take that and move forward is to develop those healthy coping strategies, identify what's going on, come up with a coping strategy. And so, you know, help them go from what if to what is. You know, you help somebody move forward, examine, come up with a strategy, talk about it, and figure out ways to move forward. And then again, avoidance. The only way around, and I love the statement here, only way around is through. You know, as you go through situations, you prepare yourself, talk about it, get a strategy, take it on. You learn, you grow, you get stronger. And that experience, I mean, that's the resilience piece, learning and growing from certain situations. How did I respond? How did I react? What can I do differently? And as you apply that, you know, you can work through a checklist, make a checklist of what needs to be done to make sure you can move through this, analyze it, think about it, come up with that plan. And then, you know, the other piece of this, and we'll show another slide here in a minute, but practice mindfulness. There's a great chart in here that mindfulness is big. Meditation, mindfulness, free that mind from that anxiety, let it go. So
Hey, Alan,
yes, yes, yes.
we had a question in the chat. Laura
Sure.
wants to know if we can explain a little bit more about going from what if to what is. And so I think I may be able to just add on to.
You know what? I'm going to let you do that because I know you're good at that.
Well, we'll see. So Laura, basically what we mean by that, anxiety is very future oriented. So a lot of times we see kids worrying about, oh, you know, what if I go to school and let's say they have anxiety over maybe getting sick at school. So, you know, what if I go to school and get sick? Or what if I go to school and the bully that's been, you know, bullying me singles me out and I get embarrassed in front of my friends, or I don't know what to do? Or what if I have to give a presentation in front of my class and I get really nervous and I freeze up? So, you know, anxiety is really future oriented. Kids are constantly thinking about what if, what might happen, what could happen, you know, the 10,000 scenarios that could happen. They're running them through in their mind. And so one of the helpful things that parents, guardians, grandparents can do for kids is to bring them back to reality by helping them focus on, you know, what is. So, okay, let's talk about, you know, what is true. You're a good public speaker. Or what is true, you know, you like going to these classes at school. Let's think about some of the things that are true in this situation versus running through the 10,000 scenarios that could potentially happen, whether at school, whether at home, in any situation that might be causing the child anxiety.
Yeah,
Just,
and Brittany, I like in there too, if you identify what can be causing that anxiety, and if it's maybe they need some help on developing their presentation skills or this or that. So it's a great way to identify ways of helping, supporting, and making that plan.
yeah, and Laura, you know, even to your point, one of the you know, questions you had, you know, if you're being late or not being good enough, you know, one of the things that a child may say is, you know, what if I'm in a relationship and I don't feel like I'm good enough for the other person, for older students or for younger ones, you know, what if I'm just not a good student? What if I fail all these tests because I failed my test last week? What happens if I fail all these tests? I'm not going to get, you know, into college, or my teacher's not going to like me, depending on the age of the child. You know, these kind of thoughts may vary. But, you know, bring them back to reality and saying, okay, well, let's talk about what is true. You know, you've gotten good grades before. So we know that, you know, sometimes we fail tests, and that's normal. That happens to a lot of people. What is true? You know, you're a good person. you're very kind, you're very compassionate, your teachers, do like you, or you do have a good relationship with, whatever person, whether it's a school counselor, coach, family member. Think about the things you can do to bring the child back to reality if they're not feeling good enough. What's true? How are you good enough? And, how are you good enough even for yourself? Let's talk about self-esteem.
Is that good?
Laura says, so with the fear of getting sick at school, just identify that they have no fever, etc. Yeah, and even with some kids, you can problem solve with them. So if they have that fear of getting sick at school, let's talk about, okay, well, how are you feeling this morning? Okay, you're feeling good. Well, that's good. And so let's talk about worst case scenario. Okay, what's the worst thing that could happen if you get sick at school? And kind of work through that situation with your child. Again, bring them back to reality of, okay, if you get sick at school, they have a school nurse. The school nurse is there to take care of you and to help you. The school nurse would call me, and I could come and pick you up if you're very sick at school. And again, we've been talking through some of these situations, to be sure to let the child express how they're feeling, to make sure that, their voice is heard, but also as the parent, guardian, older adult in the child's life, we want to be sure that we're not giving in as well to some of these things. So if a child is calling us 3 times a week because their stomach hurts at school, there's probably an indication that something more is going on there, that we need to explore, right? Versus if a child gets sick at school one time and it's kind of a single event, then okay, that happens to a lot of kids. So again, I think it's just working through with your child the things that are true in this moment that we know. And even, again, what's the worst thing that could happen in that situation? Let's work through the worst case scenario together and talk about that.
I think it's also important when you're talking about worst case scenario is always say, okay, what is the best thing that would happen? What is the worst thing that happened? And prepare for both. And then wherever it falls, it is fine.
Yeah, I always like that, Renee. What's the worst thing that can happen? And then what's the best thing that can happen? I like that.
Because I think we have to be, as parents, very careful about the words we use. I always laugh because I was talking to a student who I thought normally had great days. And I got a call from his mother one day, and she said, he's having horrible days. And so I finally took him aside and said, okay, I'm hearing this from you. I'm hearing this from your mother. What's going on? And he said, well, to be honest, my mother only pays attention to me if something bad has happened. So if I say things are great, she has other things to do. So we need to make sure as parents, we are not asking leading questions like, did everything go okay at school? We want to set the expectation that things are going to be fine or things are going to be great. And then, if something doesn't go as well, we'll be there for that too. But we want to set the expectation that life is not hard, dangerous, scary. There are times that it can be, but for the most part, it isn't. And I think going back to that worry question, I always think it's great for kids with anxiety to keep a pad of paper next to their bed. And if their worries are keeping them up, to just have them write them down. And then they don't have to think about them all night because they've written them down. They don't have to worry about forgetting them. And then the next morning you can pick them up and do that what is, what if and what is. And if anyone heard Daryl Bellamy talk, he actually had read a study that showed that 80% of what we worry about never happens. Now, of course, if you're an anxious child, you think that you're going to be the 20%, but eventually you'll get to the point where you realize that vast majority of things don't happen.
Renee, even to tag on to what you said, even for, keeping the pad of paper beside the child's bed to write things down, if it's a younger child that's anxious, have them draw a picture, draw a picture together of what worry looks like or what their anxiety looks like, and make it a conversation piece between you and your child. Could be helpful as well for younger ones.
Looking good? Does that work?
I think we're good to move on.
Okay, that's all I'm waiting. I
And
want to make sure everybody got what they needed, and we'll always meet at the end as well to talk further.
and we have 30 minutes, Alan, left on our presentation, just as a time check-in.
Hey, man, I got to watch. I'm with you. I'll be done in time. I appreciate that. You're not going to make me anxious. So anyway, little humor there. So let's see. I like this slide here too. It's good information. Show empathy, encourage, and continually evaluate. Model healthy ways of handling anxiety. Modeling is great. And then highlight that worry has a purpose, and help the child start thinking of anxiety as a thing separate from who they are, the bully in the brain. Just some examples here. So a couple of other points here. Do not reinforce the child's fears. Your tone of voice, body language, keep that in mind. Be objective and encourage the child to tolerate anxiety. And I like to tolerate it, manage it is the key here. Limit the child's anti-participatory time and reward for positive behavior. What are we saying there? There's a point where you want to focus on getting your child engaged, moving forward, and you want to reward that positive behavior and work to limit the time that they don't get involved and don't move forward and take on some. I like to think of things as challenges, take on these challenges, the things they're feeling. So engage with the child on their level. And I mean, bend down and interact face to face rather than talking down to them. But, just try to, that's the empathy, understand, connect, and help them learn coping skills and strategies and move forward and help your child to problem solve. And that, again, that goes that statement I said about coping strategies and moving forward and help them to do that, make good decisions. Very important. So helping a child manage anxiety, these 3 C's. Remember compassion, always be kind, and care, and that kind of, you want to radiate that, communicate it, and be that. And remember coax, gently encourage and push. You don't want to start saying, hey, you need to do this, you better do that. Coax. I also like the word coach in there too, but calm. Parents and guardians, caregivers, always remember to remain calm. And that I know sometimes that can be tough, but just these are things to keep in mind. That's why we're doing the training. And so when we explore obstacles and create accommodations in school, just a couple of points here. Think about this, to be able to use liberal use of flash passes, to be given passes to go to the nurse's office or somewhere else that they can go to get out of the classroom there and calm down. Eating lunch in an alternative setting, and an ability to, example, use a nurse's office restroom if that's an issue. And just to have time to yourself to do what you want to do there. Pleasurable activity upon arrival. This is something teachers can coordinate or make happen, but caring for the class hamster, doing some art, some kind of a relaxing, pleasurable activity. And always reach out to school counselors, school social workers, or a private therapist to help with accommodations, to come up with these plans, what accommodations need to be made, what would be helpful in this specific situation or case. And so those are important. That's important.
And Alan, one thing
Yes.
that I talk about a lot in different presentations is encouraging families to be proactive about things. And so, rather than reactive. So if you know your child is struggling with anxiety, it's been an issue for them maybe in the past, be proactive about that. So before the school year officially begins, over the summertime, it's a really good opportunity to reach out to that school social worker, to reach out to some of the school counselors, because I know in Fauquier and Rappahannock, both groups of people are in the building. They have at least one school social worker or counselor in the building during the summer. And so that's a good opportunity to go in and talk with them. These are the things my child is struggling with. And I think even after the pandemic, so many of us can empathize with how kids may be struggling once they go back in the classroom, because we've had a year of a lot of students being at home, and getting very used to being in a home environment, which for a lot of children is very comforting. So we may see anxiety rising as we head back to school, with kids not knowing what to expect, especially for some of the children who maybe are in those transition years. So going from, let's say, preschool into elementary school, from elementary school to middle school, or from middle school to high school, we can see that anxiety increasing. So work with the team at the school to figure out what accommodations might be appropriate for your child if they're needed. Or even just, letting your child, if they are in those transition years and don't know a lot of people at their new school setting, trying to go in maybe before school starts for the fall, and letting them meet one or two of the teachers or the school counselors, doing a tour of the school, showing your child where the classrooms are. That can be a really big anxiety trigger for kids. I know some of the students I've been talking with in the mentoring program I work with are really nervous about high school, because they don't know where their classes are. They don't know how to open their locker with a lock combination. So even trying to think about ways you can prevent some of those things ahead of time can be really helpful to your child and decrease anxiety as they actually get into school.
Yep, I like all those points. And I'll say, coming out of this COVID, look, the parents really are the front line. They see changes in their child, and it would be important if you see anxiety increasing, depression going on, any changes in mood or behavior, it's worth checking it out, but it's also worth letting the school know what you've seen. And I'm going to tell you, I did some graduation presentations with some scholarships, and I listened to some students talk, and they had a couple come forward to explain what it was like for them being home during this COVID, especially like during their senior year or other years when they're used to being around people, they're doing their studies, they've got that healthy routine going, and it's led to some depression, anxiety, other issues. So if you see it, or you've got concerns, pass it on to the school counselors, like Brittany's saying. And again, if they're going to a new school or just starting school, put it on a table. Go up there, meet with the counselors. If you've got concerns, make sure they're aware, and we know that they'll keep an eye on them and check them out, and be sensitive to that. So appreciate that, Brittany. So flashcards. I like this concept here. These messages can be important. So maybe you can develop cards that kids experiencing anxiety can have to look at, or a checklist, something written out, but with statements like, hey, just because I'm scared, hey, I'm stronger than my fear. Scary thoughts can never hurt me. Picture a kid flipping through these and finding these statements, and it can be ones they create and write out that they know will impact them and support themselves, but you can help them do it as well. I know I can do this because just because I'm scared doesn't mean I can't do it. It's okay to be scared, and again, there's other people that get scared. So that's a great statement there. I can get through this if I pause and breathe. That reminder, okay, be aware of what's going on, calm down, take a deep breath, relax, take the pressure off. Anxiety is temporary and harmless. I am safe and this will pass. I have survived this before. It's happened before. I've dealt with it. I am just going to let this pass through my body while I breathe. So those are just some examples. And, you know, it's nice to look at those yourself and think about them, because when you're talking to maybe someone who has anxiety, a child, you might even mention some of these. Hey, has this happened before? Well, how did you handle it then? You got through that? You know, pat yourself on the back. Remember that, those kinds of things. So it's important. Practicing mindfulness. That was on that chart before, but, you know, mindfulness helps us to focus on the present. You know, I love that resilience statement. The coordinates of my daily life, the coordinates of my daily life are here and now. Mindfulness helps you do that, to focus on the present. Promotes emotional intelligence. You know, and think about it. Again, I'll go back to that present. If your mind's in the future, or you're dwelling on the past, you know, that can cripple you or disrupt you. I'm here now. What actions can I take? You know, so you build that in there. And in recent studies, mindfulness was shown to increase gray matter responsible for self-awareness and compassion. You know, so I like this chart here, and we'll start. You can discover that there are ways to approach the mind skillfully. And as we go around, mindfulness teaches individuals to be aware of their thoughts. What am I thinking? You learn that chatter of the mind is worry and not helpful, and then you can let it go. I don't know about you, but just reading this is calming me down. I'll tell you the truth, just reading it. But you can acknowledge anxiety without getting caught up in the negative thoughts it generates. Now, how peaceful is that? Okay, I got this anxiety going on. I'm not getting caught up in it. I'm going to identify, I'm going to be that detective, separate the stuff, deal with it, cope, move forward, and use some of the stuff I've learned, and get help if I need it. So beautiful. Remember, you do not have to face this alone. For caregivers, guardians, parents, stay calm and listen. Get educated and include the child in this part. You know, it's education is a beauty. You know, you learn, you grow, you study stuff. Education, I don't even have to repeat that. Have helpful phrases prepared to say to the child when anxiety strikes. We went through that. We gave some examples. Connect and share with others. It could be others that are going through the same thing, or others who can help. Realize that you're going to make mistakes. You know, as we move forward, we try to address issues and make changes. We're going to make some mistakes, but I love this positive self-talk. Don't beat yourself up. Pat yourself on the back for trying this stuff. Learn from the mistake. Other people are doing the same thing. Learn and grow. Be resilient and keep moving forward. And always seek professional input and help if issues are not resolving. Get that guidance, get that support, have a plan, but get that extra help. So helpful phrases you can use. I will say something and I want you to say it exactly as I do. I can do this. Close your eyes. Picture this. I get scared, nervous, anxious sometimes too. It's no fun. We'll get through this together. You're not alone in how you feel. Man, that normalizes stuff right there. That's a beauty. You're not alone. There's others that feel the same way. So when you look at counseling support, I'm not going to stick on anything too long, but you know, cognitive behavioral therapy, reframing how we think, you know, challenging thoughts, exposure therapy, there's family therapy, parent education and support, and, you know, there's medication. You know, families play a critical role helping to reinforce needed coping skills in the moment when their child's anxiety is highest. You've heard me repeatedly talk about coping strategies, triggers, emotional reactions. come up with those strategies to manage what's going on, those coping strategies that are healthy, and help guide your child and encourage that. So it starts with families, and it can be given to kids. I do it in counseling. You know, I help children who are going through this. I use the resilience stuff. Same thing we're talking here. They embrace it. They begin to do it. You can guide them and they can learn it. So just a little, this role of medication. You know, medication does not have to be long-term. I jumped on to resilience, but I don't want to belabor this either. But, you know, there's always this thing about medication. And I don't mind saying this, medication isn't always necessary. I like that in the hands of a professional, but as parents, we want to make sure that something is used appropriately. If it is, what's the impact? What's the harmful effects? I don't mind saying in some of the families and kids I've worked with, I've seen it make a difference, but doesn't have to be the first thing. If it's needed, leave that up to a professional maybe, but always explore, how is it working? If a child's on medication, I like that, constantly review how you're feeling, what's going on, and evaluate. And if something is changing in their behavior, contact the doctor quickly. You know, we've always done that thing with the depression and any other mental health issue, but be alert the impact that it's having, you know, and ask the child, what are you feeling, what are you experiencing? And they'll tell you. I've done this. Be alert, be certain to tell the doctor and give that feedback.
And also, Alan, just a quick little note. When exploring medication for a child, you know, of course, this should be in conjunction, as you said, with a medical doctor, with a professional. But usually medication is always paired with some sort of therapy. And the reason for that is we found it's most successful. So research has found that, you know, children who do have to be medicated for anxiety, you know, in some cases that's appropriate and necessary. But really, when you're pairing it with a trained professional, with counseling practices, the child can be on medication while learning coping skills, while learning how to manage their anxiety, learning techniques that can help calm them down. You know, they can keep building their self-esteem, resilience, all of those good things. And the medication is actually more effective when that's the case, you know, when you have someone the child can check in with to continue working through this. And oftentimes you find that, you know, children don't need to be on medication for a prolonged period of time. Once they become more stabilized and they learn some coping techniques, they can manage it on their own.
Certainly. And definitely, Brittany, just to be in counseling, we're not just saying take a medicine and hit the road. Medication, definitely continue the counseling, learn those skills, and until you're capable of managing it on your own. So good points. And so me, if you know me, I love resilience. I love talking about it. I love living it. But let's talk about building resilience, how to build resilience. Stay consistent in what you do with your child. And, you know, I love this here, maintaining daily routines that work. You know, sometimes people have routines and habits, but they're not effective. They're not working. So find those routines that work, maintain them, and then begin to build around that more, or whatever you need. Teach children self-care and self-awareness. You know, and I love this stuff. What are you feeling? What are you experiencing? How? What you know, talking about what self-care for children, sleep, you know, rest, diet, little exercise there and that kind of thing, and engaging and talking in healthy ways. You know, but they can learn to take care of themselves. I feel better when I eat right. I feel better when I get to bed early, you know, and so that becomes a habit. That becomes a routine. And set a positive example for youth. Don't just tell, hey, you do this, you do that, and then you're doing something else. It's good to set those positive examples. And again, I don't want to be a preacher here or dictate to people. I'm just saying it does help. So make a list of goals together and allow the child to check them off as they are accomplished. How great is that? Hey, look, if they check them off, look what you did. They can pat themselves on the back, build self-esteem, self-confidence. I'm having a habit of getting things done. I feel better, and I'm taking control. So nurture that positive self-view and a hopeful outlook. Optimism is a beauty. Focus on the positive, embrace optimism. We'll get through this. And and be accepting of change. It's change happens. It's inevitable, but learn to see it coming, embrace it, learn and grow and evolve with it. I mean, that's resilience at its finest.
And Alan, one thing I'll say about the modeling, setting the positive example for young people. If you have young children in the home, teenagers in the home, and you're that parent, because all of us have done it, where you're swamped with work, you're bringing work home, you're constantly checking your emails, and you're appearing stressed out. Your kids are picking up on that too. They're seeing that. And so how you can respond to stress can really impact how your child views stress and how they can handle it themselves. And so, sometimes we do need to bring work home with us to get it done, or we may have things that are happening in the home. And it's okay to acknowledge, wow, I was really stressed out at work today. Here's how I handled it. Here's what I'm going to do to work on my stress. Here's, how I'm going to work through being anxious about giving a public presentation in front of 300 people at my job, or whatever it happens to be for you. Talk through, acknowledge when you're anxious, acknowledge when you're stressed, so your kids can know, yes, it's okay to feel these things. We all feel these things. Normalize feeling these things. But also, don't be afraid to talk to your kids about how you're handling that, or acknowledge, you know what, I don't think I'm handling my stress and anxiety very well. Here's what I'm going to do about it. So then your kids can pick up on that, and it can be a really positive experience, or even bonding experience if you have an anxious parent and an anxious child, to have that open dialogue about what you're feeling and how you're going to get through it.
Yep, I like that, Brittany, and I like this. It's not about being perfect. It's about learning, growing, and the child, the parents, everybody. And I find myself sometimes, I embrace this resilience and appropriate emotional reactions. Do I do it right every time? Heck no, man. So when I slip up, I don't mind putting that on the table. Hey, let's look how Alan responded and reacted to this. Where'd that get me? So, no one's perfect. And so you keep working together and evolve it. I like that. Appreciate it. So, we've got some resources here. Mental Health Association of Fauquier County. That's a beauty there. I don't mind saying that, Renee and Brittany and Stephanie. Child Mind Institute and Understood, www.understood.org. Isn't that a nice sound? I'm understood. I got to tell you something as we move forward. I've worked with a lot of people over a lot of years, and I would say one of the biggest triggers I've heard from people that gets them going, gets them worked up, is when they feel like they're not heard or understood. I think it's a good place to be right here today. Think about if someone's got anxiety, they got depression, they got anything going on, to connect with them, identify that, explore it. What are you feeling? What are you experiencing? I want to know. I care. What a place to be with somebody, to let them feel understood. How calming can that be? You know what I mean? So anyway, just putting that on the table, and there's some contact information for me. Don't be afraid to get a hold of me. I'll give you my number. I'll give you anything you want. And we'll talk about that in a minute.